Hey, it's Leanne from Healthful Pursuit, and this is another mini-sode of the Keto Diet Podcast. You guys can grab the podcast extra for today's episode by going to healthfulpursuit.com/podcast/x31. I got one cool thing for you guys today, and that is that January is totally dedicated to busting the keto myths and sorting out fact from fiction, which is why I'm holding a free training on Wednesday, January 9th. That's today. You still have time to join if you're listening anytime today. You can join me to get the truth behind the 3 most stubborn keto lies that are holding you back, plus answers to top questions, including why even the most dedicated keto women struggle to get traction, and how 3 simple strategies might be all you need to start seeing better results. You don't want to miss this free training, so head on over to healthfulpursuit.com/training to register, and then I will see you there today. There's still time, so head on over there. Today is the only day that I am going to be sharing this training. So again, that's healthfulpursuit.com/training. If you can't make it today, that's totally fine. Just sign up and I will send you the replay as soon as the class is done. Today, I want to chat about how keto is different for women. If you have questions about today's content, head on over to healthfulpursuit.com/contact and ask me. Okay, let's do this thing. Welcome to the Keto Diet Podcast, the show all about keto for women so you can burn fat, balance your hormones, and heal your body. Starting and maintaining keto can be challenging without the right support. So just for listening to the podcast, I want to give you 20% off the keto beginning with the coupon code Keto Podcast. That's all one word. This 30-day program gives you a clear step-by-step how-to so you can quickly adapt to a ketogenic diet, avoid common struggles, and get the results you crave. Go to healthfulpursuit.com/begin to get your keto beginning discount today. If you're new around these parts, I'm Leanne Vogel. You may know me as the international best-selling author of The Keto Diet, founder of HappyKetoBody.com, or maybe you know me as the nutritionist that likes dipping pork rinds in avocado oil mayo. I'm so glad you're here with me today. Thanks so much for listening. I get asked the question a lot, how is keto different for women? Isn't it all just the same? If men have success, why wouldn't women have success? I think my favorite answer to this is women have a 28-day hormone cycle. Men have a 1-day hormone cycle. Like, you have to understand that our bodies are in a different place. Like, day 5 on our cycle looks completely different than day 16 of our cycle. We are a completely different human and everything is different by then. And I think hormone balance really is the key to feeling great in your body. And when we can balance our hormones and understand just how important they are to our overall health, we can really start to step into our own power. And we can use the ketogenic diet to support that power. So some people say that the keto diet helps women to better their hormone regulation, and on the other side, there are skeptics saying that keto inhibits hormone regulation. If you're starting keto in an effort to balance your hormones, it's important to be mindful of what's going on and how you're setting up your ketogenic diet. The keto diet can help to balance hormones, but you have to be made aware of possible obstacles before you get started or while you're on your way. It's always better to understand what you might be up against as opposed to getting in a sticky situation, or not even a sticky situation, but like not loving your lifestyle because you chose a different path because you didn't know what your options were. So let's take a look at how hormones can influence your ketogenic diet based on a few common hormonal imbalances. The first is insulin resistance and uncontrolled blood sugar. So your pancreas produces insulin when you eat carbohydrates or sugar, and the glucose response that is created by this consumption sends a message to the body to release the insulin and send glucose into the cells. Overconsumption of carbohydrates and the elevated levels of insulin that follow are linked to a handful of health-related issues. So most American diets, which include an overload of carbs and sugar, this insulin release happens way too often, leading to blood sugar spike after blood sugar spike, and eventually a resistance to insulin. So insulin resistance is becoming more and more rampant, and most people only find out that they are suffering from it when more extreme chronic health issues crop up, like, hey, you're like days away from hitting diabetes type 2 is what a doctor would say. The most efficient treatment for insulin resistance is prioritizing healthy nutrition and lifestyle decisions, which will then stabilize blood sugar and insulin levels. So keto can help insulin resistance and uncontrolled blood sugar because keto assists with insulin regulation and blood sugar control. Keto also helps to decrease the stress that your body undergoes when your blood sugar spikes and dips. So less fluctuations means less cortisol being released. Since the adrenal glands are responsible for cortisol release, eating carbs can put significant pressure on them. Keto undoes this pressure and helps your body to release less cortisol, allowing your adrenal glands to function more efficiently. So the bottom line here is that the foods you eat on a ketogenic diet put less strain on the body in comparison to the foods you eat when you're eating a high carbohydrate diet. They also better regulate cortisol metabolism, which leads to better hormonal balance overall. Then we have like reproductive infertility problems, PCOS. So PCOS is polycystic ovary syndrome and is the main reason for infertility in women. And PCOS stems from poorly balanced reproductive hormones. Over 50% of women who are diagnosed with PCOS also have symptoms that align with metabolic syndrome, high blood glucose, and insulin resistance. PCOS has no cure, and many individuals who suffer from PCOS are relying on a ketogenic diet, which is so awesome. Keto can help PCOS and other reproductive issues because keto helps to regulate glucose metabolism. And studies are starting to show that this treatment is working. And many keto women who had been diagnosed with PCOS prior to starting keto show significant improvements in insulin levels and reproductive hormone balance. Some women in the study, and we'll link up to it in the show notes, the one that I'm referencing, even become pregnant, often overcoming fertility issues that they had previously been struggling with. And there's lots of anecdotal evidence that points to an increased quality of life, whether that be through a higher chance of pregnancy or reduced PCOS symptoms. Back to today's episode in a sec. Today's episode is sponsored by Perfect Keto. Perfect Keto creates the ultimate products for making the keto lifestyle easier and more effective. All of their products are dairy-free, made in the USA, gluten-free, doctor-approved, and use zero fillers. From exogenous ketones to boost your ketone levels for mental clarity, keto bars for a quality fat snack, MCT oil powder for making your coffee fatty and creamy without the dairy, and so much more. You can get 20% off anything in their shop by going to perfectketo.com/KDP. Use the coupon code KDP for your 20% off anything your heart desires. If you're unsure of the link, simply check out today's show notes for all the details. Okay, back to today's episode. Then we have thyroid disorders and diseases. And a lot of people say that keto affects the thyroid, but I'd like to kind of bust this through a little bit. So the thyroid gland plays a leading role in hormone regulation, and a thyroid that isn't working effectively can be a big troublemaker. Thyroid imbalances can cause a long list of disorders and diseases such as hypothyroidism, Hashimoto's, and Graves' disease. So keto can help with thyroid imbalances such as with autoimmune diseases. Focusing on treating and strengthening the immune system can be more beneficial than focusing solely on healing the affected organs, so thyroid in this case. So when it comes to treating the immune system, keto is awesome. Ketones can slowly begin to re-regulate the immune system, which will in turn help the other organs that are involved, balancing hormones from the ground up. Evidence shows that when you switch to a ketogenic diet, T3, the active thyroid hormone, decreases. So some critics suggest that this could cause hypothyroidism. However, lowered T3 on the ketogenic diet can be attributed to the fact that the body is just able to work more efficiently when it's in ketosis. And when we have lowered T3, we have lowered sex hormone binding globulin, which means you have more free available hormones to either use or ditch out. They're not just sitting in your body unable to be used. So in some cases, lower T3 can actually be good for you because it can help to retain your muscle when you're losing weight, and not to mention the sex hormone binding globulin. Then we have premenstrual syndrome, PMS, which includes everything from mood swings, brain fog, acne, to depression, fatigue, food cravings, and irritability. Keto helps with PMS because it balances hormones, and it can relieve many of the symptoms associated with PMS. So if you're like, I have a problem with hormones and something you just mentioned I need help with, You can treat keto as a lifestyle and not a diet. By treating it as a lifestyle, you're going to make lifestyle choices and it's not going to feel limited or restricted and ew. Expect the beginning to be slow. So know that hormone imbalances don't just go away with a snap of a finger. It's going to take some time. You can also try practicing carb ups. You can try eating plenty of high fat and good quality protein and really work to reduce any unnecessary stress. I'm going to be including a couple of tips and guides on how to do all this and more in today's show notes, which you guys can find at healthfulpursuit.com/podcast/x31. And I will see you soon. Bye. Thanks for listening to the Keto Diet Podcast. Join us again in a couple of days to discover more keto for women secrets for your fat-fueled life. The Keto Diet Podcast, including show notes and links, provides information in respect to healthy living, recipes, nutrition, and diet, and is intended for informational purposes only. The information provided is not a substitute for medical advice, diagnosis, or treatment, nor is it to be construed as such. We cannot guarantee that the information provided on the Keto Diet Podcast reflects the most up-to-date medical research. Information is provided without any representations or warranties of any kind. Please consult a qualified physician for medical advice and always seek the advice of a qualified healthcare provider with any questions you may have regarding your health and nutrition program.